Okay, so you've begun to think, hopefully, a little bit more deeply about reflection. This short narrated screencast is designed to help you to go even further in your reflection and think about transforming your perspective. In other words, not confirming necessarily the way that you look at the world, and to also encourage you to move perhaps from surface or strategic learning to really deep learning that transforms your view of yourself, not just of knowledge and of the world. Look at this triangle and reflect upon where you feel that you are. You may well be at the phase of being able to evaluate your knowledge and evaluate the value of your reflections. You may not be at the phase yet of creating new knowledge, new perspectives, new ways of understanding, especially if it feels uncomfortable or unfamiliar. Part of the rationale for the SAIL module is to encourage you to find new ways of seeing as a really competent practitioner who reflects and is able to change their decision in the light of new and conflicting and ambiguous information to get the very best strategies in place for the individual patient. This may become clearer as you work through this screencast and consider Schoen's approach to reflection. At first sight, when you compare Gibbs's model of reflection, with which you are probably very familiar, with Schoen's model, which has been related into writings about reflective practice, originally derived from the practice of teachers, but now very influential in terms of clinical practice in healthcare too. So on looking at both of these and comparing them, you'll see that the Gibbs cycle can go round a number of times, leading to action and reformation. As with Schoen, ladders of reflection, in this case, is looking at the reflection on the action and then recursively future action cycles. So it looks on the face of it very familiar, but when you move to the next slide, maybe you'll be able to see a difference. So Schoen's approach, which is much less of a model, more a theoretical and a process and a formulation, is that at first the practitioner learning to reflects on action, i.e. after an experience or a piece of care practice has actually taken place. To reconsider the situation, look at what worked and what didn't, and think about what to change for the future. This, of course, may happen, as you well enough know, very soon after the experience or at quite a time distance. He further conceptualises the role and value of reflection in action to then support reflexivity, changing action at the time, drawing on the bank of experience and reflections to actually consider the situation and its complexity and its individuality and act immediately based on that very quick in vivo reflection, which you will have noticed that competent and confident practitioners can undertake, and you yourselves might be. So the idea is, in this model, is saying using past experience and learning in the moment to have impact. As I mentioned at the outset, we want to take you from surface learning, just skimming the top, maybe so that you can recall things and perhaps work more by rote, which is often the way of clinical procedures, particularly those that are time critical. It's important, of course, to be able to act quickly and follow the rubric, but to be truly competent and move towards expertise, You need to move beyond strategically learning the things that you think will, in this case, get you through assessments or get you through your practice, to being deep learner and learning about yourself as well as the situation. So you consider the knowledge aspects, the affective, i.e. the emotional, perceptual and individual elements that apply to you, as well as the action that arises from that deep learning. So in this case, the module will take you perhaps beyond being very comfortable and put you into an uncomfortable phase. That is okay. It is not necessary to feel comfortable in your learning all the time. In fact, if you're comfortable and cosy and we are teaching you too much and giving you too much scaffolding, you may in fact learn less than you do if you have to think about uncomfortable things and uncover some of your own biases, some of your own assumptions, some of your own wobble zones. This slide is moving towards Metzgerau's model of transformative learning. You can see here the first two boxes describe non-reflectors. You have all moved into being reflectors, analysing situations, relating the experience, learning from it. But critical reflectors, it's argued, develop a new perspective. They are transformed in the way that they look at their world or their knowledge or themselves or patients or people, but also seek to validate the new perspective to make sure that it is bona fide. Okay, so Metzgerau discriminates between the kind of learning that's about making our own interpretations, understanding the meaning behind experiences and becoming autonomous thinkers. So again, this is where some of you may feel a wobble zone coming on during the SAIL module, in that in years 1 and 2, at level 4 and level 5, apart from the psychosocial elements, much of the learning has been to more factual elements or those where there's much less ambiguity, where maybe you don't have to think as autonomously. That is by no means a generalised assumption, but in order to profit most from the SAIL module and most from all the learning experiences to build you to being truly competent and confident, and later on, as a registrant, to being an expert, you have to be comfortable in understanding what informs your interpretations and your assumptions, the meanings that you attribute to things, and to become autonomous but balanced and focused in your thinking. Without labouring this slide too much, notice down in the bottom right-hand corner the focus being on both content and process. And what I will be stating and restating over the SAIL module is that the content of your MOOC is one thing, but the process of your learning and what comes out of it is more than equally valuable. It is in fact the value from this module and will help you, if you stick with it, in your lifelong learning. This slide points out that we need to understand that we filter the world, and this leads to faulty attributions and distortions in our thinking due to our beliefs, feelings, attitudes, past experiences. And in order to be as effective as possible as learners and as practitioners, we need to uncover those distortions in our beliefs, assumptions and perceptions. And we learn, or need to learn, to look through the world in multiple pairs of spectacles, not just the ones that we have normally approached looking at the world in. Okay, so a bit of homework. The picture shows you the reflective practitioner, Schoen's work. Some of you may find it a little turgid. Certainly at first it is worth sticking with this, really worth sticking with it, particularly the second half of this particular chapter, where he really theorises about reflection on and in action, and therefore in practice. So it's worth it, and I'm asking you to read and think at a deeper level than some of you may have previously felt comfortable with. Okay, good luck, and take time to really take stock and reflect on it. And if you have been feeling uncomfortable, start to probe what is making you feel uncomfortable and what you're learning from that.